So welcome those who are on the virtual meeting here today. Welcome to Showcasing the People Behind the Research, Usability Practices that Help Keep Your People Connected. My name is Kevin McDermott. I'm here with my colleague, Rebecca Mayu. We'll do some introductions, more formal introductions in a couple of slides, but we are gonna do some trading off and talk about some of the recent usability work that we've been working on so far. Could you go to the next slide, Rebecca? Okay. So here's our tagline for the session today. Understanding your users can uncover how they work and the challenges that they have interacting with each other inside and outside your institute. So that's focusing on the specific projects that we've been working on recently at our institute, which is NIAID. So this is really going to be about championing usability testing, interacting and reaching out to your users. So our agenda, we'll do some introductions at the next slide. We will talk about goals and methodology, and then we'll dive right into the work and some of the things that we did, and then talk about what our next steps are. So this is an ongoing project. And then at the end, we'll have some time for questions. So if you do have some questions, I think we lost Rebecca in the slides. If you do have questions, there is a chat window and there's also a Q&A. So if you want to put your questions in the Q&A, welcome back, Rebecca. Can you hear us?
I can hear you. I'm just having a little trouble with my connection. Sorry.
Gotcha.
Okay. It keeps kicking me off.
Okay. We'll try and work through it. I was just saying we'll do questions at the end. There is a Q&A tab in the, it should be to the right of your screen. If you want to put the questions there so we can have them all in one place, that's perfect. Okay, next. Intros, Rebecca, you want to go first?
I'm Rebecca Mayu. I'm a UX strategist. I have been doing this since dinosaurs roamed the earth. My primary purpose is to instill or encourage common sense and making the world find information and move through websites and applications.
Yep. And I'm Kevin McDermott. Rebecca and I both work at the National Institute of Allergy and Infectious Diseases, NIAID, with the New Media and Web Policy Branch. So as Rebecca mentioned, our main goals is to essentially understand the user's needs for NIAID and Web and New Media Policy Branch, and figure out what the best user path is for NIAID's digital properties. So that's the public website, the intranet, and a few other smaller websites as well. So today we're going to be highlighting a couple of projects that we recently worked on and how we approach usability and how that helps design new websites using Drupal, which is our content management system for all our major websites. So some quick goals of the projects that we were working on. We wanted to get, we wanted to be able to talk to some of the users. At the Institute, we've got a lot of researchers and a lot of labs that do a lot of really important work to identify contagious infectious diseases, things like SARS and COVID and lots of things that have been in the news lately. Those labs and those researchers communicate both to one another and also to the general public through the public website, obviously, and internally on our intranet. So several of them kind of reached out to us and wanted to find new and better ways to enhance that communication. So, so with these projects that we're going to be talking about today, we wanted to really get into how the individual researcher, how their individual roles impacted the larger work at NIAID, help them communicate with internal researchers who might be doing similar work that somehow overlaps. And also there's a large external research community that our researchers want to be able to interact with and communicate with. There's a lot of collaboration going on among that community to help, do things like find vaccines for pandemics like COVID-19. Next slide.
Now, we did go through a lot of different methodologies and tools as we were doing this. We take an iterative approach. So information leads to the need for or the implementation of information and along through the line. So we circle through and do iterative development and testing as we go along to try and improve the vision. In the case of this project, we were doing stakeholder or user interviews. We have used that information to help develop personas. We established journey maps related to those discussions. Revisiting discussions, we would go back to people with more questions. From that, we developed a service blueprint, and we're also working through wireframes and prototypes, and that'll be going on into our next steps. As we all know, the world is different and new. In 2019, there are things that we would do in person. We would get together and we would have whiteboarding sessions. We would have meetings in person. We would talk to our stakeholders or our participants in person. And just have meetings, actually just be in person. Well, that's something obviously we're not doing. We're all working remotely. But what we've done is we've taken the methodologies that we were familiar with and worked well in person, and we have converted them, as we all know, into an online system. So, Zoom meetings and conferences such as this, and doing remote calls or Zooms with our participants, and also using tools that allowed us to collaborate online. So our whiteboard is now a virtual whiteboard using Mural or Miro. So those are the things that we are, working on, and to very good effect, because we're having wonderful results and wonderful interactions with our participants.
Yep.
If nothing else, 2019 has turned into 2021 of a wonderful view of how we can do everything remotely.
Okay, so we want to talk about identifying the problem. So every project always starts with a problem. And sometimes zeroing in on that problem can be a challenge in and of itself. And so we'll talk a little bit about that. And that's one of the reasons that we want to do some of this usability testing. So earlier in the year, we had some other folks at the Institute tasked with trying to uncover some of the Institute's larger problems. They had an idea about creating a tool that would help with communication among researchers and clinicians at NIAID, and to help them do their jobs better. So we took a lot of the research that they had already worked on, and as we were going through, we realized it dovetailed really nicely with another project that we had for the public website, which was to help researchers and the labs and clinicians communicate externally, communicate what the research that they were doing to these external researchers and to the general public. So this opened up an opportunity for us to get some FaceTime or virtual FaceTime with some of these actual researchers, which was really exciting. Obviously, a lot of their time is taken up with doing the research and taking care of patients. But with these connections with these groups, we were able to set up some interviews with folks. And what we really wanted to do was, sometimes when stakeholders will come to us with a project, they typically have a design already in mind. So we wanted to sort of validate and verify this really is the problem that we're trying to solve. And this is going to be something, if we develop it, this will be something that people will really use, and they'll interact with it in the way that we think they will. So that was kind of the beginning of this process. And then we had insight and were able to actually talk to users.
Wonderful. So talking to users, as I said, we did stakeholder or user interviews to a group of people who work within the clinical and research areas of the NIAID Clinical Center. They're conducting research to either check on the efficacy of a drug or treatment protocol, or to follow the path of the disease itself within individuals to see how they progress and what kind of work is done. That's called a natural history test or natural history research. So the folks that we talked to were able to give us great insight into what their daily lives are like working with their bench work, but also about themselves. And information feeds further down the line. It feeds into other things we're going to talk about. But we discovered that they have great passion for their work. They're very proud of what they do. They're proud of the work they're doing and the people that they're working with. They also do a lot of things. They are multitasking all the time, either a week of clinical work and then a week of bench work doing actual research. There's documentation, there's follow-up, there's patient care. They have a great desire to connect and collaborate with their peers. The challenge for them, though, is finding who they need to talk to if they're not already familiar. So what they've done is they have developed their own tools and workarounds. As with everybody else, you have your contact list in your phone. These folks have developed their own contact list, so they know who in Dr. So-and-so's lab they need to talk to have, to get permission for this lab to be run and have. It's also, they're missing on a training and a networking tool in the same way because they just don't have those connections. So there are a lot of needs that we establish during these interviews. So as we were going through these interviews, we developed, my very brilliant colleague, Cindy Amato, she developed this wonderful spreadsheet where we were tracking out comments and we were seeing where they were falling into. And this was one of the first ways that we were establishing patterns by determining where there were commonalities in their comments. So just your basic Excel spreadsheet made that a lot easier. From there, we went into doing something called an affinity diagram. Now, this is another one of those activities that would normally be done in person, but we were doing it using Miro, where we took pieces of information, the tool they used, or their frustration, or the success point for them, or the interactions they were having, and we started plotting them all out. And it was a wonderful thing. You can see that we did it in real time. We did it together, and we started making groupings. By the end of the exercise, we then categorized the groupings, and that gave us a little information. For example, what the technology is they were working on, or in this case, where their joys or what was important to them and where their challenge. You can see a little bit of that. And being organized is important, and I like working with my team, and I like working with the nurses. Or don't know who to contact would be one of the challenges, or information might be outdated, and they don't know half the staff in their own group. So these are the challenge areas we picked up based on, and joys based on our talks. So when we looked at the kind of information they would like to have, we also contrasted that with the other activity that Kevin was for the outside facing, the public facing website. And we noticed there was a great deal of overlap in the information they were looking for in both systems. So you're looking at an internal tool for the staff to use, and then the external or outreach one. And we saw, as I said, a great deal of overlap. Now, this gives us an opportunity to consider the way the data is going to be captured from the individuals and then how it goes back out. I have this terrible analogy I use, and it's called a pot of stew. If all the information you have is in a pot of stew, when you put that ladle in, you're going to be getting certain elements. Apologies. And when you put that ladle in again, you're going to get different components. So that's where we are right here. The external website might have some subset of the information we collect from all of the NIAID employees, and internal would have something different that would allow a little more specificity. So after coming through that, we establish a journey for the patient. Now, the patient journey was important because it gave us more information on the touch points with staff. And that's where we're ultimately going, is where are we having communication breakdowns? So this does not look like a normal patient journey. This is just a wonderful list of bullet points. But we established in this, there are actually 8 different patient journeys. Which I won't go into here, but we chose to focus just on the inpatient journey at the clinical center. So we took that information and we worked it into what's called a service blueprint. I don't know how many of you are familiar with this, but a service blueprint is a wonderfully complex document that takes you a long time, but gives you great insight into things. And what it's doing is it's allowing you to understand the entire picture of the customer experience. And you get to see where they interact with people, where they interact with systems, and where those systems support them. And it also allows you to identify where there are gaps, either in the services being rendered or in our understanding of that service. And that gives us an opportunity to go back. So in the case of a service blueprint, it's broken down roughly in the system we used is you have to think of it in terms of a play. So there's things that happened in front of the curtain, things that happen behind the curtain, and things that happen below stage. So in our case, we have the patient journey. If you're looking at this kind of graphic, what you're going to see is the patient journey is up on the white line, the white swim lane. I've just given you a little piece of it to make it a little easier to see here. And that tells you, in this case, the patient learns about their diagnosis. So that's point one. Point two is the front stage activity. That's the green swim lane. And that's where they interact with their care team. So here we have the primary care informs diagnosis and additional support resources. So the doctor is telling them, okay, this is what you have, but this is what we can do to help you. Okay, and then we move on to the blue swim lane, which is the backstage activity. And what that does is gives the steps and activities that healthcare provider is going to be rendering. So in this case, they're looking for possible studies for the candidate, or helping the candidate or the patient find studies. And then behind that is the support or for the product or process. And that's what I call like the below stage. That's where the systems are in place. And in this case, the website is going to help with the patient find information. But that's the system that the doctor is using that informs the patient. So that's just an example of how the service might work.
Yep.
As I said, it was complex. It was beautiful. This is the complete visit from the patient diagnosis and looking for some kind of a clinical trial or a care trial or a treatment trial, all the way through discharge. So this is how we've mapped it out. Now you may notice some of these fields are blank. Those blank fields, and also fields where that we have red, indicate areas where we have more questions. The questions, they will inform us as we ask questions of our stakeholders. If we go back to them, go to the client, do additional interviews with folks to get some more information about that. So that really, it's a wonderfully iterative tool that really helps you get to the point where you can understand the entire journey for whichever target you might have there.
All right, personas. So both the blueprint that Rebecca just was speaking about and personas had something in common. One second, got an airplane going overhead. They were tools that helped us take all that expansive data and to sort of distill it in a way and process it in a way that makes it easier to understand. So, so you saw when Rebecca was showing the spreadsheet, you've got all these different pieces of data. You've got, we had multiple users that we interviewed. There was hours of interviews that went on, hundreds of pieces of data, and it was a matter of trying to process all this data in a way that we could then present back to the stakeholders and to the users and say, this is us making sense of all these different pieces of input. So you saw that in the service blueprint. I know it was kind of a lot to take in, but that was one way of processing things. We wanted to get that data out of the spreadsheets because honestly, people see a spreadsheet and their eyes kind of glaze over. So spreadsheets are great for us to kind of organize all this information, but these visuals like the service blueprint, even though that's kind of complex, you can sort of zoom in on. The persona is another tool that's really valuable in sort of showing all of these, different people that we interviewed, all that time, spent with them, all those different pieces of data, putting it on a single page. So personas, sort of this definition gives a little bit of a description. The personas are fictional characters which you create based upon your research in order to represent the different types of users that might use the service, product, or site. One of the ways that we use personas is to kind of have is a visual representation of our user. And, when we were sort of in person, these are the kinds of things that you put on the wall and you always can look back to it to understand, okay, this is who I'm designing for. But it also, we found it was a really helpful tool in sort of driving this project and driving the design process forward. Could you go to the next slide, please? And how we did that. So again, it drove the process forward because we took the data and we started, making sense of it and finding the commonalities. And I know this is a little bit hard to read as well, but we pulled things out like what their roles and responsibilities are, what they care about and why, and challenges and frustrations. So those are the big things in the main body that you see there. In challenges and frustrations, we actually pulled some quotes from some of the individuals that were really impactful, that I think, and it's one of the good things about the personas, is they really stand out when someone's sort of looking at this as a single document. And then there was other bits of information that we were kind of adding as we sort of went in, and we were able to look at the persona and say, all right, let's think about this in terms of the tool that we're building. What are the gaps? So just like in the service blueprint, where there was areas that we need to go back and talk to those users because there's gaps in some of that process and things that we don't know. Personas were the same way. So it was like, okay, let's focus. We asked them a lot of questions. There's a lot of information here, but how do we sort of present this in a way that will make our design of a tool to help them come out a little clearer? So we added things like on the right column, some of the tools that they currently use, some of the tools that they might use to find other employees, some of the tools that they use just in their lab alone. And that really kind of helped us focus on where we want to gather more information and move forward with our design. Next slide. Okay, so I'm going to shift gears a little bit and from the tools that we use to kind of gather information and those user interviews to talk about the actual design process. So what you're seeing on the right-hand side is a wireframe that our colleague Cindy Amato developed for the external site. And the purposes of wireframes, for folks who don't know, it's to create a visual representation of what we think the design might look like once we build it and put it on our website. So it's not meant to be, picture perfect, pixel perfect, but it's meant to have like a good representation. So you can see in this instance, we built something out that kind of had all the different clinicians and staff scientists and researchers in one place. And we wanted people to be able to find those folks. And so we determined we would allow people to sort of filter the results by different categories, like what disease or condition does the researcher focus on? What are their, what types of patients do they see? Where are they located? Specialties, things like that. And you can see we kind of mocked it up here. It's sort of, if you're familiar with the Amazon or the Zappos model, it allows people to filter down. And our theory was that people would filter down until they found the person that they were looking for by using some of these tools. But before we went and built anything, we wanted to sort of test that theory. And that's the great thing about doing the prototypes. Before you bring the coders involved and have them start coding, we can put something in front of actual users. And that's what we did at this stage. Cindy was able to go back and show them what we had and ask, is this something that you would actually use, and how would you use it, and what would you filter on? So it's very helpful. And also, and we'll talk about this a little bit more, we can put this in front of our developers and say, does this make sense? Is this doable? What kind of a lift might this be for you if we were to develop and design something like this? So wireframes, pretty common and a pretty powerful tool, using them as prototypes. And again, going back to that user was something that that was really helpful for us here. So next slide.
Kevin, can I jump in with one thing?
Absolutely.
With this tool, we're also working with the inclusion of photographs. In addition to their experience, education, and areas of specialization. And the reason for including the photographs is to increase visibility of NIAID staff and also to meet another need of the project, which was diversity and inclusion. And we were helping to show the face of NIAID.
All right, since this is Drupal GovCon and not Usability GovCon, wanted to talk a little bit about metadata. As folks who are familiar with Drupal know, one of the real benefits of working in Drupal is being able to use metadata to enhance the content, to enhance that user's experience. So behind the scenes, we were gathering all this metadata that we were able to create taxonomies. And those were the things that power those filters. So Drupal is able to create something called a views page, and it's powered by this metadata, and it pulls in all these different pieces of content, and there's hundreds often, and then uses the taxonomies and this metadata to sort of filter things down. So there's a couple screenshots here on the right for folks who are familiar with sort of the backstage of Drupal. This is what it looks like when we put our metadata in, and when folks create that content about somebody, about a lab or a physician, they can then go and tag that content, and then that's what powers that Drupal views page. So going through the metadata and the taxonomies and developing those is something we're not going to get into too much. Suffice it to say, we are gathering those sorts of bits of information when we are going on in our user interviews. We had a lot of feedback from the stakeholder group, and they had vetted a lot of terms that they thought might be useful as taxonomies, and then we're validating that through search result testing. So one of our analytics folks was able to go in and take a look at what people are actually searching for, and does that match up with some of the metadata. So that was really beneficial to us as well as we moved forward. All right. And as I kind of hinted at before, this is really a team sport. So the usability team did get that great opportunity to go in and talk to those users and pull out all this information, this data. Once we have that out there and we have it in a way that we can present, we go back to the stakeholders. We bring in folks from the development team. We bring in folks from the analytics team, from the content team, and we say, this is what we're seeing. This is who our users are. This is who we're designing for. And so at that point, we get a lot of feedback from folks. And like I said, it's an opportunity for our developers to say, this is feasible. This is a heavy lift, or this is something we can do easily, or you're going to need to come back to us with a robust taxonomy to do something like that. So, and it's a circular process. So we interview, we bring that feedback back in, we review things like analytics, we design, we put it back in front of the users and test. We then present it to the developers, who then build something, and then we start it all over again. Once we have something live, we still want to go back to those users and see how they're actually using the tool in real life. And we'll pull in analytics, and we'll talk to users again. And if we need to make improvements, then we go back to the drawing board and we improve. So it's a really iterative process within our group.
So what comes next? More. That's basically the answer is more. We're going to be proposing doing more interviews to reach out to a different part of the clinical team to get to see where there are similarities and differences. But that, in the meantime, as Kevin said, we're working on the analytics for the data side to determine what those tags and areas are going to look like. They started with 400 terms. They've got it down to 120 that they're working with right now, looking at things, and we hope to go a little bit deeper. Also do a little more testing, perhaps with doing tree testing on those as well, or card sorts and then tree testing. So interviews, more testing, more design, and then we'll begin doing wireframe testing and usability testing as we go forward. So more is basically what's next. Any questions?
I did see some things in the chat, and I know some of those, like the blueprints, were hard to see. So if folks have anything, if they want to throw it in the chat or the Q&A section, happy to field that.
Kevin, I already addressed a question about the personas and about the education level for folks with the personas. I indicated that we were going to work with staff first and then move through. Q&A.
Right. And that was one of the things in this whole process. We had a set of folks that we were working with first. And I think one of the things that came out of that was like, well, who else can we talk to? And so that's a discussion that's going to happen in the near future. And, identifying all those different things that you mentioned, like health literacy. I think health literacy would be more for the external folks, like the patients. Right now, we're focusing on the internal folks. So But yeah, those are things that we want to build out moving forward.
So first question we have is, how do you get buy-in putting the users first?
Luckily, we have a great branch chief. I think she's on this not call, but in this conference right now. Tori Garden is a big champion for putting users first, and she's been like that even before things like the 21st Century IDEA legislation came out, saying that the federal government had to do things like this. So Tori's a big fan of this, and you know, we keep her in step with the things that we're doing, and we meet on projects like this and show wireframes and get feedback. And you know, we're planning on doing something we call an art board, which is just putting the personas up and the blueprints up and letting the stakeholders kind of take a look at it and say, okay, I still have questions about this, or this is an interesting piece of information. You know, tell me more about something else. So really getting them involved, and luckily they're, like I said, they're very proactive and very hands-on. So that's a great thing. So we are lucky in that respect.
What is this process like for getting internal buy-in across teams?
Across teams, so is it teams within New Media and Web Policy Branch, or is it different stakeholder levels, or can you clarify, Ann? Or is it the development team, the usability team, the content team, that sort of thing? I'll talk to either one. Again, we've got a really good team. We work pretty well in lockstep with, and I think one of our development product managers, Ruby Duke, is on mine as well. Pretty well with one another to talk about when do we want to pull everyone in to get their input and get their feedback on the work that we're doing. And they offer that feedback as far as like, yes, this is feasible, or we could do that, but it's going to, you know, require years of development work. And we have a phrase called, is the juice worth the squeeze? So is the return on investment going to be worthwhile? And I think, okay, I'm going to chat. I think as far as across teams, as far as different stakeholders within the Institute, again, that's Tori Garten, Alice Litzinger, who's our core, also is a good champion for that. And we will speak to other divisions, other branches, and help us out and really advocate for this type of work. All right. Siloing across teams who are working to keep their pieces afloat. So interesting. Okay, so go ahead.
I was going to say, these are new pieces. So they're the pieces that we've been working on are new. It's new functionality. So we're not infringing on anyone's existing pieces per se.
Right. But you did mention something about siloing, which is something that's interesting. It's actually one of the things that we're trying to help the researchers overcome. They work within their own labs, and there's other labs that have, like I mentioned earlier, overlapping functionality. And I think two of the folks that we spoke with, you know, had never interacted with one another before this project started, and they realized that they shared a lot in common and could learn a lot from one another. So that was one way to break down the silos. Another interesting thing, this might not have been your question, but you mentioned silos, and I get excited. The reason that we used the patient journey in that service blueprint, even though it went outside of the bounds of where we're really going to probably focus for this particular tool, is it identifies a lot of different touch points that you might not necessarily think of if you just go and focus on, let me talk to the folks in this one lab, because you'll still get just that viewpoint from, you know, from the ground rather than that 30,000 foot view that we try and take a look at as well. And getting that 30,000 foot view is great because then you can zoom in and really focus. And I know that didn't answer your question, but address your question, but did some of what we said make sense and help out. Excellent. Any other questions? We got a couple more minutes.
We've got
Toby, in a scenario where there are some budget constraints, how do you prioritize the stages of research? How do you choose what to do and not to do? What criteria would you use to make such decisions? I'm guessing this is asking about how do we choose which projects to move forward with. I think we obviously we want to help everybody, but you're right. If there's a lot of requests coming in to do lots of different things, we do have to do things like weigh return on investment, overall value to the entire institute versus value to individual groups. Obviously, individual groups are very important, and the work that they're doing is the most important work that they're doing. So, if there are conflicts, sometimes we have to figure out what's going to add the most value. But you definitely want to make sure that everyone is at least heard, and you can let them know that you're thinking of better ways to help them out all the time. And I think some of the work that we do with one group can carry over and benefit other groups for certain. And again, Tori makes the final call.
yes.
Other questions? Don't be shy. All right. Well, I hope this was helpful. I know we went through a lot of different things quickly, and slides are kind of hard to zero in on, but I think you can always reach out to Rebecca or myself if you have other questions in the future. Always happy to help and reach out and promote usability and promote putting users first, to other institutes and folks working in Drupal. It really does, sometimes there's a hesitancy to do usability testing, and there's a tendency toward, let's just develop something. But it really saves everybody a lot of time, the developers, the stakeholders. If you take some time to do some usability testing and get that feedback, because then you make sure that you're creating something that's valuable, and you don't have to go back and recreate it later. You can make iterative improvements, but you don't have to toss out the entire project. So,
and just to stress another point, which is very salient, time is money. Rework is money. So if you get the input in the beginning, it saves you time, money, and rework later on.
Yeah, exactly. And some of these, when it goes back to getting buy-in, I think some of these artifacts, putting that in front of not just the immediate stakeholders, but institute leadership to say this is where we want to focus, and showing that you really know the user and you've really identified some real problems adds benefit as well. All right, thank you all. Thank you all for coming, and again,
thank you so much.
Yeah, thanks for letting us speak. Bye, everyone.